This week we will do session 2, and this week we spoke about 3 different elements of psychoanalytic psychotherapy that define it. 1, depth-oriented, and we focused on how this entailed observing and taking a patient perspective. Today we're going to talk about it being patient-directed and what that means in the context of frame and free association, and then we'll move on to the other elements as the third part of our series. And our conversation will end with free association and evenly suspended attention. But I want to kind of give a context that has to be within a frame. So frame is a psychoanalytic concept, and like the frame of a picture, it outlines the borders of what you're looking at. It helps give color, it helps draw the eye to what's important and what's not, what's inside and outside the boundaries. Now, frames can shift depending upon their need and aim. If you're dealing with patients that have more severe psychological suffering, it may require a more rigid frame that can actually sound more flexible if we compare it in one way. More rigid being that we need the patient to agree not to communicate with us in between sessions, to bring up their concerns or comments in sessions, that here is a particular way if they're starting to have thoughts about psychosis or suicide, what they need to do. A pretty rigid frame is established within the transference-focused psychotherapy world, where they have developed a specific psychoanalytically informed manualized treatment for patients with suicidality. In some ways, though, that's going to be flexible compared to the classical idea that perhaps a patient with that level of severity couldn't be seen. So it establishes the boundaries. They can be negotiated. They can even change across time. It's important that any negotiation or any change be explored as to the meaning why. And the reason to have the frame is if you color outside the lines, you want to know what's going on. Is it because, say, a patient wants to see if you'll say anything is good? So maybe if you think about when a kid brings you art and you know they can color within the lines and they color outside the lines, they may want you to kind of suggest that, oh, I wonder why you're doing that. It may mean something. Or if they color outside the lines, are they communicating that actually the frame you've established isn't what's going to help them, even if they had agreed to it? So it can be negotiated, changed, but it needs to be discussed. And frames can exist in the outpatient world, where I primarily practice, or practice at this time, and that would involve the location, my office or online, the frequency, every 3 months, 1 month, weekly, 4 times a week, how I'll be paid, how much I'll be paid, etc. In the inpatient world, also, the frame is established by the place you're at. Is it the emergency room, a locked unit, on a medical ward? What's the commitment status of the patient? Are they on pharmacology? That's also kind of a frame. Are they taking medications or not? That's also true of the outpatient ward. And then if you get kind of called to do something outside of the established frame, are you called back to the bedside of a patient you've already seen that day on the inpatient ward? What does that mean? What are they communicating? Kind of trying to understand how pushes and pulls on the frame are actually communicating meaning if you know what the frame is. If there hasn't been anything established in your mind or provided to the patient, then how will they know if they're outside the bounds or not, or will you know? And it's important because the frame then can serve as a container of emotional content. So instead of a patient acting out by doing something violent, they could use their aggression not to pay you, or they could use their aggression to not listen to you if you're on an inpatient ward, or to refuse their medicines. But it allows for emotion to be communicated in a recognized manner that keeps everyone safe. It can allow for really big emotions if people know what the boundaries are. And as I've already said, if a frame change occurs, miss fee, appointment, request another audience with a different clinician, request another audience with the same clinician at a different time, you can follow it, you can bend it, but it can be used to give information. The classical elements that would also make up kind of the psychoanalyst stance within the frame, in addition to these kind of logistic means were neutrality, abstinence, and anonymity. So neutrality was kind of historically that you want to, so these three things would build neutrality, and kind of can be overlapping Venn diagram concepts. I think you can see it that way. And there's something in the core of that that would have been an idea of like a blank screen, and then that allows a mirror for which the patient can project their psychic contents onto that can then be seen, read, and interpreted. Today, and that would then allow a neutral stance toward the patient's conflicts. Why are they seeking help now and not later? Why are they thinking you can do this for them? Those kinds of questions could be asked if the analyst withholds, doesn't offer reassurance, doesn't step in to solve the patient's problems. Abstinence, again, withholding reassurance or judgment on a people's decisions. At the worst, though, this can feel really cold. This can feel like someone's uncaring and aloof. At the best, it can help patients help keep focus on the patient. And you can see if it's not followed and you're overly reassuring and overly taking care of a patient's issues, it doesn't give them a chance to try and grow and learn from mistakes, even if they're obvious. And they might not be mistakes, even when you think they are obvious. They might turn out to be something else. And then anonymity, the classical idea was to disclose really nothing about your internal world, constantly redirect to the patient's inner mind, and use questions as a chance to wonder why they might be asking why you're married or divorced or have children or done this and that. More modern, people often don't disclose kind of things that are personal to the person outside of the consulting room, but may be more apt to disclose perhaps their experience of an emotion, something that the therapist has noticed in the patient outside of just strict interpretation. The emotional turbulence or change within the room also is disclosed much more so now. And there are very select times when people may disclose information about themselves, though it has to be wondered about because it is a break of the frame and trying to understand what is being asked or expressed in this. So if you have a frame, then people can feel that they're able to freely associate. So free association. So this was Freud's fundamental rule, and he wanted people to have suspended mental. He's asking people to stop censoring what they're saying. He would tell people, as if you were on a train car, looking out the window, just describe all the elements that are passing by. And where the patient stops or can't, that then is a sign of classical term resistance. And that then is the place of the work, how to free up resistance so that people can access their inner thoughts. He thought drives, inner longings, inner wishes, inner fantasies. While I think free association is very important and it is a great acknowledgement, I think that it's more than just drives we're trying to free up. It's like a person's ability to think. And it may be that actually now, a patient, the job may be to acknowledge that the work may be just to increase people's ability to freely associate, to be able to play with their thoughts, just as a child will play with toys. And so you can think of the adult's conversation as the same way you might approach child therapy, play therapy, where they're introducing characters and asking you to join in. The same can be true of an adult, and they may have a hard time enjoying in that playfulness. And then so the free association is the task of the patient. Evenly suspended attention is the task of the therapist. And Freud wrote, the technique consists in not directing one's notice to anything in particular and in maintaining the same evenly suspended attention. As I have called it, in the face of all one hears. If the therapist follows their expectations, they are in danger of never finding anything out but what they already know. And that's from Freud's Recommendations to Practicing Physicians, 1912, page 111. And so it's the same encouragement to let go of presuppositions and assumptions and to allow your mind to think clearly so that you can enter into the patient's mind. And from this state of no assumptions, get to know them and understand their world. Both are actually very hard to do in pure form, and it's unclear to me if anyone can do it in a pure form. But I think if you have one, free association, the task of the patient within the context of an evenly suspended attention, task of analyst or therapist. I'm using analyst and therapist interchangeably here. If you reference back to session 1, you can use these techniques in any phase of psychological treatment. But when these two both occur, it's possible when both feel safe and secure in the setting of a frame. And what I'll leave here is with the image that, like, you need a fence around a playground to explore the whole yard. So I can't ever find this study, and it may be apocryphal, but I think the story holds for the point I'm trying to make. So that there was a study around at a playground, and they took one group of kids and they put them in this wonderful playground that was big and large and had all this wonderful equipment spread across the whole yard. Same setting, same playground, it's just had a wall around it. And when the kids had the wall, they actually explored the far edges of the playground instead of just staying in the middle as they did in the former, presumably because they felt more security in knowing where they were held. So the frame provides a container where the emotions that arise in free association can be experienced with the analyst, knowing there's distance, but knowing also the analyst or therapist will be there to help be present to them.